What do we consider in situ vaccination? So basically, anything that generates a localized tumor lysis can be considered an in situ vaccination. So starting with strategies that are used very commonly for treatment of cancer, like radiation, for example. Radiation was never really considered to be immunotherapy, but interestingly, there are reports of patients that would get a radiation to one lesion and would see regression of other sites on their body. And there was actually a report of a patient that was treated with ipilimumab for metastatic melanoma and was progressing, and then got a radiation for one of the progressing lesions just because they needed it for the pain control. And it was not only that lesion that has responded, but other cancer and other lesions in the patient's body have responded as well. So just sort of suggesting that if you take one site that has this, contains these tumor antigens and release them in the right kind of a manner, you can really kind of generate an immune response that can be active at other sites as well. So the strategies of combining radiation with immune checkpoint blockade are actually currently being explored in clinical trials. But you have mentioned, you asked, are there any strategies that are actually approved for this? And yes. So the telomergen laparivec, or the TVEC, as it's most commonly known, is indeed such a strategy. It's basically an in situ vaccination strategy. All you do is that you inject a lesion with, in this case, oncolytic virus, and then sort of generate this inflammatory immune response to the tumor, which then becomes active systemically. So I think it's a good strategy to kind of take on and evaluate for other cancers.